Welcome back. This book will be answering the most frequently asked questions about your medication Flomax. This includes how should you take it, when should you take it, how long will you need to take it, how long does it take for the medication to work, are there any side effects? What is Tamsulosin or Flomax? It is a medication used to manage symptoms of a condition called benign prostatic hyperplasia or BPH. BPH is a condition that can affect men as they get older. The prostate gland located at the base of the bladder enlarges, and muscle fibers that are present in the prostate can become tight, preventing the easy passage of urine from the bladder to your penis. Tamsulosin helps prevent this tightening. Flomax belongs to a group of medications called alpha blockers. They work by causing a relaxation of muscle fibers that are in your urinary system. This helps improve flow of urine and ease your symptoms. In some cases, it can be used off-label to ease the passing of kidney stones through the urinary tract. So what is the correct dose of Flomax and how do you take it? It is available as a 0.4 milligram or 400 microgram capsule. It is generally taken once a day at a dose of 0.4 milligram to 0.8 milligram. Ideally, it is best to take it 30 minutes after the same meal each day. Most people choose to take it after breakfast or after the first meal of the day. This is to ensure the medication is working during the daytime. It should be swallowed whole, not to be chewed or crushed. Flomax should start working soon after you take the medication. However, it may take several weeks before you see the maximum effect. If you accidentally forget to take a dose of Tamsulosin and you remember within 6 hours, take it as soon as you remember. However, if it is almost time for the next dose, skip the missed dose and take the next dose at the regular time. Please do not double the dose to make up for a missed dose. What if you take too much medication? Overdosing on Flomax can be dangerous. If you have taken too much, please seek urgent medical attention. In overdose, it can slow the rate of your heart and cause a drop in your blood pressure, and this can make you feel lightheaded and dizzy. If you need to go to the hospital, it is important that you don't drive yourself. Get someone to take you or call the ambulance. How long will you have to take Tamsulosin? If you're taking it to help manage symptoms of enlarged prostate, it is likely you will need to take it lifelong. Stopping the medication will likely cause a recurrence of your symptoms. Who should not take Tamsulosin? It is advisable to speak to your doctor if you suffer from any of the following problems: previous allergic reaction to Flomax, suffer from orthostatic hypotension where you feel dizzy or lightheaded when you stand up. This is due to a drop in your blood pressure, and this can increase your risk of falls. It is best to avoid Flomax if you have a history of severe liver problem. Liver disease can slow the removal of Flomax from your body, which can lead to increased side effects. Also, you should avoid Flomax if you're planning to undergo cataract or glaucoma surgery, because it is known to increase the risk of complications such as intraoperative floppy iris syndrome. Some medications can interact with Tamsulosin and lead to undesired effects. Since Tamsulosin can have an effect on your blood pressure, you should use caution if you're also taking high blood pressure medications, because it can lower your blood pressure too low. If you have to take Tamsulosin, you might need close monitoring and dose adjustment of your blood pressure medications. Also, taking other alpha blockers such as Dosage, Prostate, and Tamsulosin may cause a decrease in blood pressure. Combining medication for erectile dysfunction such as Viagra and Cialis can lower your blood pressure. Also, there are medications that may decrease the removal of Tamsulosin from your body, such as ketoconazole, which is used for fungal infection, and antibiotics such as clarithromycin and erythromycin. Also, you might be asking if there's any foods that you should avoid while taking Tamsulosin. Grapefruit and grapefruit juice may increase levels of Flomax by altering its metabolism. Also, try to take Flomax 30 minutes after a meal, as fasting increases absorption, leading to high medication levels in your body. Another common question is, can I take alcohol with Tamsulosin? For most people, it is safe to take alcohol with Tamsulosin, but there are some people that may experience symptoms of dizziness and lightheadedness. If you experience these symptoms, it is best to avoid alcohol while taking Flomax. Does Tamsulosin have any side effects? Most people taking Tamsulosin will not experience any side effects. For few that do, most of them improve over time. The most common side effects include orthostatic hypotension, which is a drop in blood pressure when standing from sitting or lying position, dizziness or lightheadedness tiredness, which could be related to the drop in blood pressure. And getting up slowly may help with the drop in blood pressure and dizziness. Another side effect is abnormal ejaculation. This can vary from only producing a small amount of semen to no semen at all. You can also have headache, stuffy nose, and runny nose. Uncommon side effects include palpitation, nausea and vomiting, constipation or diarrhea, back pain, insomnia, and drowsiness. Some rare but concerning side effects can occur. If they do, please seek medical advice, such as allergic reaction. This allergic reaction can present as difficulty breathing, angioedema, skin rashes, episode of collapse after taking the medication. Another rare side effect is priapism, which is persistent erection of the penis for greater than 4 hours. Remember, these side effects are not all inclusive, and you might experience other side effects which are not listed on this slide. If this has been helpful, hit that like button and be sure to subscribe for more health related videos. Until next time, stay healthy and remember, health is the greatest wealth.